Good evening. My name is Liz Krueger, and I'm your host tonight. Welcome, everyone, to our town hall meeting on supporting your child's adolescent mental health, emotional wellness during COVID-19. This is a topic that I think every parent in America is dealing with over the course of the last 22 months. We have a packed event tonight with quite a few experts, so I'm looking forward very much to their presentations. And then there'll be a chance for Q&A at the end. I want to first welcome you all if you're viewing on Zoom or on Facebook or calling into the town hall discussion this evening. Before I get to our guests and our proceeding, I want you to be aware that we have closed captioning available. As a viewer, you have to activate closed captioning to view the text on your device. If you're in Zoom, click on Live Transcript in the meeting controls to start viewing closed caption. If you're on Facebook Live, you'll see a setting button in the bottom right-hand corner of the video. Click Closed Caption, CC, to start viewing closed captioning. Just a few announcements before I begin the event. On Tuesday, September 28th, Pfizer submitted COVID-19 vaccine data on children ages 5 to 11 to the FDA for initial review. The company expects to submit a formal request for emergency use authorization in the coming weeks. The FDA has stated that once a completed request for an EUA is received, the FDA will carefully, thoroughly, and independently examine the data to evaluate benefits and risks as quickly as possible, which may mean taking weeks rather than months. In-school COVID-19 testing is an important part of keeping your children and school safe. If you have not already submitted a consent form, it is important to do so. Even if you completed a consent form during the last school year or summer, it is still necessary in New York City to submit one for the 21-22 school year. You can submit the form online using an NYC Schools account, NYCSA, or you can print and complete the form. And now we're going to move to tonight's event, supporting your child's emotional wellness, adolescent mental health during COVID-19. I want to thank the event's co-sponsors, the New York City Department of Health and Mental Hygiene, and my colleagues, Senator Brad Hoylman and Jose Serrano from the Senate, and Assembly Member Rebecca Seawright. You should know that this event is being recorded, and everyone who RSVP'd for tonight's event will receive an email of a link to the video in a couple of days from now. It's been just a couple of weeks since children started the new school year, some after learning remotely for more than a year and a half. Many students are excited to return to school to see their friends, and some have been pretty anxious and concerned about the return. Research is showing that COVID often affects our emotional wellness. Tonight, we have a great group of presenters who will discuss the impact of COVID on adolescents' mental health. First, we will hear from Elliot Goldman, who is the manager of curriculum development, and Susannah Sanchez-Agosto, who is a training specialist at the New York City Department of Health and Mental Health. They will discuss adolescents' mental health and the impact of COVID-19 on their emotional wellness, as well as the signs and symptoms to look out for and what parents and caregivers can do to support children's emotional resiliency. Next, we were going to hear from Erica Smith, a psychologist and licensed social worker who serves as the Action Director of School Mental Health Programs for the Office of School Health at the Department of Education and at the New York City Department of Health. Dr. Smith will share school-based mental health resources you might want to draw on as parents. Finally, following Dr. Smith, we will hear from Sara Madod, an infectious disease epidemiologist who is the Senior Director of the System-Wide Special Pathogens Program at Health and Hospitals Corporation. Dr. Madad will provide information about COVID-19 virus and safety mitigations. And our last presenter will be Ben Morden, the president of District 2's Community Education Council. He will share information from a parent's perspective about adolescents and how COVID impacts their emotional health. So now it is my pleasure to introduce Elliot Goldman and Susannah Sanchez. Good evening.
Hi, good evening, and thank you for that introduction, Senator. I'm honored, as I'm sure my colleague Susannah is, to be part of this panel. I really appreciate it. We had prepared slides, but because the situation with COVID is changing so quickly, we were not able to get the review done by the Office of Communications at the agency, so I'm just going to be presenting without slides for the moment. As you said, Senator, children and youth are going through an incredibly challenging transition. Schools are reopening. They're going back to seeing friends. There's a relief, I think, in going back to a regular routine. And many children are looking forward to being vaccinated. But for some children, there's depression, there's worries, separation anxiety when leaving home. Parents are seeing symptoms like stomach aches, persistent sadness, irritability, loss of interest in activities, etc. There are sleep changes, there are occasionally some suicidal thoughts, weight change, etc. This all gives us a sense that our youth are really struggling with this transition. I'd like to talk for a minute about loss. This is a topic that comes up a great deal in our presentations to the community. With COVID, it's not just loss of health that we're concerned about. Certainly, many of us have family, friends, coworkers, or neighbors who've really struggled in the loss of health or loss of life or loss of connection. However, children really experience not just concerns about health, but there's a loss of regular routine. A lot of kids, including teenagers, really depend on a school routine. As much as they say they don't like going to school or don't like doing homework, it's something that's expected and expectable, and they can rely on that kind of routine in their lives. There's also a sense of loss of safety, with rapidly changing medical situation and information. Sometimes the information's conflicting. It's not always clear what to do. Kids can have a sense of safety and security that's shaken at times. Also, parents they know are struggling with job changes or unemployment or financial stress. Teenagers and essentially all kids have a sense that their lives and their world is being shaken up. So we want to focus on what caregivers can do to help their children deal with this situation. The first thing we're suggesting is assessing risk. It's really important to have ground rules around things like spending time with friends and wearing a mask outside of the house. We know there are mask rules in schools, but what about when you go out with your friends for the afternoon, or you get a bite to eat, or you're just hanging out at a friend's house? Parents sometimes really struggle to balance safety and caution with a return to regular routines. It's important also to be aware that parents have had an incredibly stressful time in the past year and a half, and it's important to seek support for parenting stress. A lot of parents, let's face it, are burnt out, and it's important to get support from friends, family, virtual communities, etc. Finally, it's important to communicate with school, particularly with your child's teachers. Many teachers themselves sometimes are not sure how to handle the situation, or it's a work in progress in terms of handling COVID. One of the reactions we got when we presented a full presentation, as we have to a group of teachers, is that they're kind of feeling their way, and really they find it important that they communicate with each other about the stress that they're under. So you can imagine how hard it is for the kids. So we're talking about regular communication with the school and teachers when concerned. Particularly important if your child's in special ed and receiving special services, whether it's social emotional learning or special academic support, et cetera. So how can we help children overall return to regular activities and routines? If your child's hesitant, it's important to encourage them to try some activities and to stay with it even if uncomfortable. Sometimes even teenagers will feel concerned about taking their mask off, or they're concerned that they'll get infected while at school. Sometimes they may feel an upsurge of anxiety or a panic attack. Certainly parents can help by suggesting ways to relax, breathe slowly, and find ways to feel grounded. We can suggest resources towards the end in terms of finding some of these relaxation and breathing exercises that can be helpful. Sometimes parents can suggest activities to help the teenager refocus. Finally, if a child or teen is overwhelmed with anxiety or they're shut down, it's important to consider supportive counseling. One of the takeaways that we got from presenting this material to teachers is that stigma, while still an issue for some, it's become clear that mental health issues are a lot more acceptable to talk about, particularly in the current climate. So it's certainly not a problem if your teen is having difficulties to seek out mental health help. And looking at the questions that people posed, that were circulated before the presentation today, finding appropriate help, support, counseling is certainly a major topic. And we can talk about that towards the end of this presentation. So in general, with your teen, what's ways to be supportive beyond, returning to school? It's certainly around making time to connect. Often teenagers put parents aside and say, everything's fine, I don't want to talk about it. But it's important to make an effort and try to talk to them about how their day went, how they're feeling. Sometimes it's just a check-in. Sometimes it's more a few-minute conversation. It's also listening and acknowledging, not lecturing, but acknowledging that this is a difficult time and helping them label their feelings and that they can come to you if they're struggling. Ask about what their concerns may be without judgment. Even if you don't agree that these are major issues, for them, they are. Particularly if they're feeling socially isolated, you can encourage them to engage with friends or family or other neighbors if possible. Some teams got so used to being alone and isolated during the last 18 to 20 months. It's like a muscle that needs to get used to regular workouts. So be aware that teens may be taking very tentative steps at the beginning about reconnecting with others. We're also suggesting to be particularly sensitive to teens that are grieving. They're grieving the loss of a normal routine. For some of them, it may be the loss of the school year and worries that they'll never catch up. They may be worried about college or what happens after high school graduation, or what happens if they don't see friends that they're used to seeing. The best policy at those times is to listen, try to reassure as best you can, but allow them time and space to grieve. In terms of mental health factors, we talked about the stress that's connected with COVID, but for some families, some parents, some youth, there are particular factors that have made it even more difficult. Some parents have lived through an incredibly high stress period, again, as we mentioned, due to financial reasons, family illnesses, et cetera. Also, there are single parent households where parents are on their own a great deal of the time. They had to hold down a job, either in person or remotely, and also tend to their children remote schoolwork. Let's face it, a lot of parents are burnt out at this point. There are families that are struggling with homelessness, and many of them may have had financial difficulties during the pandemic. So finding a place A permanent housing is especially challenging at the moment. You may be essential workers who've had enormous responsibilities and had to go to work every day, and that's their own cause of burnout and anxiety. There's also a lack of appropriate child care services or someone to watch their teens, their younger teens, when they come back from school. All these are factors that made it really difficult for families during the pandemic. Other factors may include pre-pandemic history of trauma, abuse, neglect, abandonment. Add the pandemic stress onto that, and that's a recipe for really difficult stress on mental health. One of the outcomes of the pandemic was increased alcohol use and substance misuse. In addition, there were unique challenges for youth who were LGBTQ, children with special needs, children of color. All those children and teens may have had special difficulties during the pandemic, and they need our understanding as they're readjusting to being back to a regular routine. I'm going to stop at this point and turn this over to my colleague, Susannah Sanchez-Agosto, who will continue with the youth mental health.
Thank you, Elliot, so much. And thank you again, Senator, for allowing us the opportunity to be here with you. So we can talk a little bit more about what are some of the changes in the emotions and behaviors that our youth are going through. We see that our children are resilient. Overall, throughout this pandemic, we've seen that resilience over and over again. However, we do know that the stress response that for some of our youth may become easier than to others, right? For others, it may be a bit more long lasting. As a result from the pandemic, with the regular return to regular activities within the school systems, unfortunately, we also saw an upsurge in mental health symptoms, a 20% increase with our young children worsening in emotional health with depression and anxiety. We also saw an increase in the number of crisis situations with our youth. Our high school students worsened emotionally and with their cognitive health. As Elliot shared, 60 to 70% of our LGBTQ youth reported an increase with anxiety and depression. And we also saw high levels of stress for parents, difficulties with finances, with housing, even with food in some households. And we also saw the connectedness between racism to child stress and emotional difficulties. Now, when we think about stress, and we want to also consider how it's interfering with our child's functioning and their overall well-being. If we want to think about the younger children, ages 3 to 10, they respond to stress differently than the older ones. I, for one, have 2 little guys at home, and I know that it has been very difficult to try to explain to my children what the current pandemic situation is and what it may look like for them to start the new school year. Some of the key signs that we can look for in those type of situations when a child is experiencing stress: excessive crying or irritability, sometimes even tantrums or meltdowns, regression to behaviors that they may have outgrown, like having toiletry accidents, or even having a feeling of separation anxiety. For some of our children, they may have become so attached to being with mom and or dad in the household, and now they have that return to school system where it's all new faces, all new children, and that adjustment period may take some time. That child may also have difficulties staying focused and or with their own concentration, and those symptoms may be exhibited psychosomatically, affecting their body, maybe with headaches, body aches, and or pains, sometimes even a stomach ache. But we want to continue to be supportive, validate their feelings, what they're experiencing, and give them that extra sense of love and care to continue to provide them with their mental well-being. When we talk about our older youth, maybe ages 11 to 19, our adolescents, they may struggle with worries as well, with depression, with their mood changes. And some of the key points that we can see is that they may have experiences such as excessive fears and worries, even unhealthy habits, eating habits or sleeping habits, irritability and or acting out in behaviors, or even taking risky behaviors, as Elliot shared, the use of alcohol or tobacco to cope with what they're feeling emotionally and not knowing how to be able to cope with it, but learn to self-medicate in the process. Having an avoidance of activities that they have perhaps enjoyed in the past and now they're unable to. And in the routine of the everyday, there's a sense of numbness that may have come about. Those symptoms can also appear, such as headaches, stomach aches, muscle tensions, cramps, fatigue, trembling, sweating, or even hyperventilating. And we want to be alert to those cries for help from our youth, regardless of their age. They may need someone and have a shoulder to cry on. And we may be feeling that fatigue as well. So we also have to remember to take care of ourselves in the process while we nurture our family. Some of the mental health warning signs that we could possibly see: that your child may need that extra added support, having intense, strong feelings, not just those small ups and downs, but maybe if those feelings are lingering for 2 weeks or more, that could possibly be a symptom that can show some concern. If that child is having problems with their daily activities, like being in school or engaging with friends and having that interaction. If that child is maybe using substances, and we may not have learned about it in the past, but now there's an upsurge in substance use. And we also want to consider if those signs that we're seeing, how intense they are, the duration of those symptoms, and the frequency in which it's occurring. When these things happen and we are able to become more alert to them, what we want to consider is to have a plan of action in place. What can we do for our family? What can we do to keep our children safe, even as a support system within the school districts, in the community centers? How can we still gather? It may even be virtually, connecting with someone on social media. What else can we do to support one another through this? Here through the Department of Health and Mental Hygiene, we offer multiple resources. One resource that we highly recommend through our city is New York City Well. The New York City Well hotline number is 24 hours a day, 7 days a week. It offers mental health counseling, free and available, and it's confidential. Over 200 languages are spoken. So that's a really great resource that can be used. We also spoke about a little bit about stigma, and I just want to go back to that just a bit, because when we think about stigma, what are some of the words that come up in terms of having that family go to that extra step to seek help and support? Maybe that family is considering being worried about what other people may think if their child is experiencing these symptoms or if they're going through this. That stigma can also include difficulties with their own spiritual values or even cultural norms. Maybe this is not part of my culture to seek that added support. If he or she is just going through a phase and maybe it'll just get better, right? These are some of the stigmatizing language we could hear. Or I don't want the school to know that my child is experiencing this. But if we break down and we tear apart what that stigma really is, we can really help empower a family to take that initiative to help each other. Perhaps that family member or of that child or loved one may be unsure about counseling or therapy. Who else can they speak to? Who else can they go to? Perhaps a religious member in the community, someone whose faith-based may be more comfortable for them, or having an inclusive therapist, someone of their own culture and background, like within the Black or Asian or Latin community. There's therapists of inclusion that we can also review with you and have the ability to share with you on our Department of Health and Mental Hygiene website. So just allowing families to be able to navigate the mental health system and find ways to be able to become better equipped and have a bigger toolbox available to them so that they can make the necessary changes within their own family unit, because that's where it starts. If that child, for example, is in the school district, you're seeing that that child is hyperactive, maybe using different language that they can express themselves, like that child is high energy, could be a different way in which you can see that need for or having that positive change in their life, yet not stigmatizing that child. If that child is too talkative, allowing them to be more expressive and assertive. Those words can really provide an impact on our youth. We think about suicide risk assessments. With suicidality and suicidal ideations, there are many risks involved. But again, we want to consider that we want to be alert to those cries to help. And sometimes those cries to help may not always be evident to us. It can be nonverbal cues or small gestures that our children can make. And it's being alert to those cries. And when we hear those cries for help, it can sound like different things. It can sound like, I just want to hide under a rock, or my friends won't even notice if I'm gone. So those are some of the things that, as a parent, we don't want to take it and just like a grain of salt. We want to make sure that we are tangibly making an effort to connect with our children so that they feel our concern and our care, and not being afraid to show them that care that we have for them, talking to them about their thoughts of death or suicide, taking actions while also caring for ourselves in the process and getting the necessary help as needed. I spoke about New York City Well as a great resource for us. Of course, we don't want to exclude 911 in case of a crisis situation, but NYC Well is also 1-888-692-9355, or there's a suicide prevention lifeline number, 1-800-273-8255. And there's New York Project Hope, which is coping with COVID, 1-844-863-9314. As far as other types of mental health supports, we want to make sure that our families are getting the support and the care that they need, even if they're not ready to make that intentional step towards seeking professional help. NYC Well, you can use that support through text, through chat, or even email contacts. We also can have our family, our friends, and our peers that can be an excellent source of support for us. The school community, the programs and the staff members, school staff and or clinicians, and as I shared before, even faith leaders can be a strong sense of support for our families. Okay, I think, Elliot, if you would like to share any more, if not, I can wrap up my portion. Thank you.
Great. Elliot, do you have anything else to add? No, you don't have anything to add, do you, Elliot?
No, I think that was really comprehensive.
Great.
And thank you for the time today.
Well, thank you both. So now we'll hear back from Elliot and Susannah when we get to questions later, but now I'd like to introduce Erica Smith, who's going to talk about the mental health resources available in our schools. Hi, Erica.
Hi, thank you, Senator, for having me. I really appreciate it. I apologize for the overhead light. I was not prepared for my debut, so, but thank you for giving me an opportunity. I wanted to start off by letting you know that I am representing the Office of School Health, School Mental Health, which is a collaboration between the Department of Education and the Department of Health and Mental Hygiene. And what I wanted to do is take an opportunity during the time that I have to give you kind of a snapshot of the programs that have been rolled out and are available in a lot of the schools. I'm going to preface it by saying that not all schools have all of the services within them. And that's because every school is different. And I'm sure you know that from your own experience being parents, and that not every school needs what we call an Article 31 mental health clinic for treatment. Our perspective in looking at services provided within schools is that we use a public health model. It's a 3-tiered model. And basically what that means is that we know that 0 to 5%, probably higher these days because of this pandemic and all sorts of other social injustices and experiences that our teens are having. But 0 to 5% of the kids are going to need what we call targeted services. And basically that means services that are geared towards a diagnosable mental health concern. And then there's the rest of the students. We have a middle tier of students that are either at risk or need more supportive type services. We know that not all kids meet diagnosis, but may have a few symptoms that make it difficult for parents to really kind of put their finger on what's going on. And then there's the idea, which my colleagues brought up earlier, of sort of this idea of universal services for everybody to reduce the stigma associated with mental health. I think what people forget sometimes is that mental health is not just the absence of mental health related symptoms. It's much bigger than that. So I'm going to ask Justin if he can put up the slides that I created for this. Thank you very much. Again, I'm the acting director of school mental health within the Office of School Health with the Department of Education and the Department of Health and Mental Hygiene. You can go to the next slide. So I figured I would create a snapshot for you to see Senator Krueger's district and the schools that are in those districts. If you take a look down in the middle of the slide, you'll sort of see what each color represents. Again, remember there's 1,800 schools across the city, and they see 1.1 million approximately students. And this is just to give you a sense of what's available in the schools across the city. So in this slide, what you'll see is that there's layers of services that we can provide. And I was speaking earlier about the targeted services, the selective services, and the universal services. Here are some of the services you might be able to find within schools. School-based mental health clinic, that's really a traditional, we call them Article 31s because they are overseen by the Office of Mental Health. It's a licensed clinic, they take insurance, which some people can find frustrating. But if there is a school mental health clinic in the building in which your school is in, because I know that many buildings have multiple schools within, the student is allowed to access that clinic and should be accessing that clinic. So it's building-wide service. Right now, we're in the process, DOE is in the process of building out the student-facing or school-facing pages on their website where parents can go and click on to their specific school. And what they'll be able to do is link directly if there's a clinic on site to have access to that clinic. So that hasn't happened yet, but we are working on that. In other schools, there are what we call school-based health centers, and these are primarily focused on physical health. We call them Article 28s for short. Sorry about that. There's a siren outside. But some of those health centers have mental health service providers on site and also can provide targeted traditional mental health services. Some of the other services that we provide, which sort of meet the whole community need within a school, with the aims of the goals of the services that we provide are really to build supportive environments, really enhance community and family ties, and really build capacity for the long term. So one of those models that is used by the Department of Education is something called community schools. And in terms of the services that are available in a community school, each community school has what is called a CSD, or what is known as a community district director, so to speak, and they are a contact on site in a specific school. The difference between these schools and the other two types of schools that I mentioned, the services are not necessarily school-wide. It really is dependent on the school. Some community schools have Article 31 clinics attached to them. Similarly, with the prevention and intervention program, which is a much smaller program, but functions very similarly, except they don't have a CSD on site. But again, there could be an Article 31 on site, in which case then that service across the board is available to every child in the building. I do want to emphasize with this, when I say services are available to every child in the building, when they are funded through a community school or through a prevention intervention program, these services are available to any student regardless of their status in terms of insurance. These programs we have oversight of, and they are funded by us specifically to work with students who are not insured or underinsured. No child that should be turned away. And if they are, I really do encourage you to advocate and reach out either to the Office of Mental Health or to Senator Krueger to let them know that this is happening, because this is one of the tenets of their license. They are required to see anybody who walks through their door. So we really want to make sure that that's what's happening. It's kind of similar to the idea that you can't be turned away from medical services. So I do want to emphasize that. And then we have other types of supportive services. For instance, the specialist program, where there's someone on site at least one day a week to work with the staff and to really help the staff identify when a child is in need. And this really helps build out the ability of the school to respond appropriately. Not all children need to go to the emergency room. Sometimes, as you recall from my colleagues, their presentation prior, is that they need support and they need reassurance, and they need to know that this is an environment that's going to accept them no matter what. And we have lots of programs like that. If you can switch to the next slide, that would be really helpful. Okay, so just to, it's a very complicated system, this mental health system that we have in New York City. It's a great system. It's just very nuanced and very complex. So the targeted services, like I mentioned, I just wanted you to know, direct mental health treatment for students and families. Remember, we can't treat students without treating their families, and they hopefully are a part of the services that children get. And these are for children that present with a diagnosable mental health concern, like I mentioned. So things like Article 31s, which are typically, these licenses are held by hospitals or community-based organizations, and Article 28 similarly. Selective services, student services for students at risk or in collaboration with the targeted services on site, or even with an off-site provider. These kinds of services can really help kids generalize any kinds of skills that they are learning if they are in some sort of targeted treatment. Groups, peer groups, so that they don't feel that they're alone or on their own. And then universal, which is all students, all staff, and all families. And really, these are provided by community-based organizations who come into the schools or work directly with the schools to do things like campaigns to make students feel and families feel like, the stigma around what they might be experiencing, and help them sort of really generalize the idea that mental health is really mental wellness. You can switch to the next slide. All right, so again, we talked about the models. So we have community schools, we have prevention intervention programs, we have mental health clinics and health clinics with mental health services available. Again, I mentioned that these services, it's not up and running yet, but it will be there, and we're really excited about this. They are going to update the school-facing sites and have the ability for you to see the menu of services that are available in your schools. It could be any one of these things. It could be a combination of these things. And it will also identify building-wide services that are available to you and your children. Last slide, please. And basically, there are all other types of supportive services. The schools, the DOE has been working diligently to really make sure that there are extra hands in the schools through guidance counselors, programs like Pathways to Care, which can connect students to outside clinics, school social workers, Single Shepherd is another program, and the school response clinician. So the best person to talk to if you have questions is your principal. And you are more than welcome. The last slide is a link to the school mental health webpage. I'm looking forward to your questions to see if I can help explain a very complex system with many, many supports. Thank you, Senator Krueger.
Wow. Thank you very much, Erica. Yes, and I think your closing statement was one of the, realities whenever we are looking at any issues in New York City. It's a little more complicated than, a small town option, and you really need sometimes the help to get to the correct entry port so that you can make sure you're getting your children the services they need. So thank you for the materials, and they're up on the chat, And again, people will be able to get all of this information from our website. So don't worry if you think you're trying to hurry and write all of this down. You're going to have another way to get this information. So next, I would like to move from Erica to introducing Sara Madod, who is going to present on COVID-19 and safety mitigations for teenagers. Hi, Sara.
Good evening. Thank you for having me on. I'm going to go ahead and start my presentation.
Great.
There we go. All right. So good evening, everybody. My name is Dr. Sara Madod. I am an infectious disease epidemiologist, as you've heard earlier. And I'm going to first share just a little bit about my story and my background. So in April of this year, I published an article in the New York Times, and I shared my experience with COVID-19, particularly as my entire family came down with it, back in March and in April. Really, really frightening experience. I was one of the individuals that responded to the Ebola outbreak back in 2014. And when COVID-19 hit my family, it was one of the most frightening experiences of my life. And luckily we all overcame, the infection. Nobody required hospitalization, but it was extremely frightening. And as the pandemic continued to rage on, and as somebody that has been responding from the beginning, I realized, I needed a lot of mental health support. I needed to find time for self-care as well. But then being a mother of 3 children, I also realized that with the school disruptions that's happening with them, not having that social network that they're used to, and all the disruptions that we're just generally experiencing, they also needed mental health support. And this is not my forte in terms of providing that mental health support that they needed. And so I found no shame in reaching out to counselors and therapists and experts to give me the information and strategies and skills to help them cope with what they're feeling. For me, it was easy enough for me to, go to my health system and, use the resources that they were giving, debriefing sessions and tactics and things like that. But it was really difficult to see what kind of strategies would work for my children. And as one of the therapists has told me, that sometimes, for example, my 5-year-old, they won't tell me that, they're experiencing depression or anxiety or the impact that the pandemic has had. And the way that they may express themselves is that they'll say, "Mommy, I want to play." And sometimes mommy is exhausted and tired, but I don't realize that sometimes that's their way of saying that I had a bad day, or I'm just, I'm emotionally drained, or I'm having an issue and I just want you to be there and play with me. And so by learning some of these techniques, I was able to better, help my child as well. And so I definitely want to make sure that parents, regardless of the child, the age of your children, certainly reach out. There's no shame in getting support that you need for your children. And so as a mother, I'm going to also share a couple of tips with you. And before I do that, I want to just kind of show you where we are in the current pandemic as it relates to children and adolescents and the cases that we're seeing. So as of just September 23rd, we've seen over 5 million cases of COVID-19 in children since the onset of the pandemic. So extremely high number. And adolescents make a very large portion of that 5.7 million. And nearly 200,000 cases were added just in the past week. And this has been the 5th consecutive week where over 200,000 cases have been added in that particular age group. So it's really daunting to see this extremely high number. But what we know and what we're seeing is that vaccinations are certainly helping. And I'm going to highlight that further in one of my slides as well. CDC also reports that there's increased rates of ED visits and hospitalizations, in children that are in states with lower vaccination rates. And this goes to show you that community-wide vaccination rates make a significant impact on our children. And so when you have higher proportion of individuals vaccinated in the community, that's better for you and that's better for them, because that is translating into lower infection rates, lower hospitalizations, and the like. And then studies have also found that COVID-19 cases in children and adolescents, while they have been increasing, luckily in terms of severity, it hasn't been as severe, especially with the Delta variant as it became predominant in July. And that was a big question for many of us is, with the advent of the Delta variant, are the cases much more severe in children and adolescents compared to the Alpha variant? Now we have that information. but at the same time, we know that they're not spared. We want to do everything we can to protect them. And so with that, I'm going to share some mitigation measures. And so as a mother and as a parent, as I mentioned, I want to make sure that I'm doing everything I can, to meet the needs and keep, my children and those around them safe. And so there's only so much we can do in terms of what schools are doing. But as a parent and a caregiver, what can I do? What can I have control over that will help, reduce their risk of getting COVID and to keep them safe? And in these different strategies that I'm highlighting, and in the chat, you'll see the link to this, so you can read it on your own, but I'm going to just highlight a couple of them. And so first, vaccination, and I've mentioned this just earlier in my last slide, but vaccinating those around our children is extremely important. And I'm going to give you 16 reasons why you should get vaccinated in a moment. But vaccinating on children gives them that protective bubble that they need. And then as we look at wearing masks, really important to obviously wear masks. And CDC recently came out with a study that in schools that did not have a mask mandate, they were 3.5 times more likely to experience a COVID-19 outbreak. So this really goes to show you the importance of wearing a mask, not just any mask, but a good quality mask. And I give you some examples here and when masks should be worn, for example. Testing is another really important part of our layered mitigation strategies. And luckily, New York City school systems do offer testing. But then as a parent, if I want to get my child tested because maybe, they are symptomatic or just on a periodic basis, I want to test them myself, there are testing options available. And that's one thing I can do myself for my child. Practicing respiratory etiquette and hand hygiene are certainly cornerstones for an ongoing basis. And then making sure we're knowing and keeping aware of local transmission rates and what's happening around us. So going to, for example, the City Department of Health's website that provides you really amazing, hyper local information at the city level, at the zip code level, that you can find what's happening in your community. And then lastly, monitoring health, right? This is not just monitoring health in terms of looking out for COVID-19 signs and symptoms, but very much looking at their mental health too. And as you heard from speakers earlier, looking at some of those, symptoms, for example, that they may exhibit that can show you that they need some additional support and help. So monitoring health is not just about the symptoms of COVID-19, but it's also looking at, any mental health impact that's having and any symptoms that they may be showing that you want to continue to follow up on. And so there's many reasons to get the COVID-19 vaccine. So for those children that are over the age of 12, it's really important that they do get vaccinated. And luckily in New York City, as we look at the vaccination rates among adolescents, at least 65% have gotten one dose, but we want to make sure that number is even higher. But if you only needed one reason to get vaccinated to protect yourself, here I'm giving you 16. And I'm not going to go through every single one of these, but in the chat box, you'll get a link and you can read through why it's so important to get vaccinated. And so some of the questions I often hear from individuals in the community and those that we serve, for example, is why should I get vaccinated? If I'm hearing that even vaccinated people are getting COVID-19, what's the purpose of getting vaccinated? Well, if you just look at some of these reasons, for example, your risk of COVID-19 infection is reduced by 5 times just by being fully vaccinated. And then your risk of experiencing severe COVID-19 is reduced by over 10 times. And there's so many additional reasons. So for example, in the off chance that you do experience a breakthrough infection with COVID-19, you can clear the virus much more faster and you're not as infectious as unvaccinated individuals. And the list goes on. So there's so many different reasons to get vaccinated. And I'm going to go into the next slide. So in my last slide, I'm sharing how you should understand COVID-19 vaccines, how our immune system works, what's the importance of getting vaccinated, and if you've had natural infection, why it's important to still get vaccinated. And so similarly, in the chat box, you'll get this link and you can download it and read more about understanding COVID-19 vaccines and why it's so important. And as in today's world, as we're hearing about so many different variants circulating, whether it's Delta or Mu and any other variant here locally or even around the world, you're seeing how well these vaccines are holding up. So this booklet gives you a little bit more information. And so with that, I'm going to hand it over to the senator.
Thank you so much, Doctor. That was really excellent. And we were going to be, all of us, I think, wanting to download these materials so that we can use them ourselves in many different ways. And with that, I'd also like to introduce our last speaker, and then we will move to the Q&A portion. Our final presenter is Ben Morden, President of District 2 Community Education Council and a parent with children in the school system. Hi, Ben.
Hi, Senator Krueger. Good evening, Senator Krueger, on our panel, and to all the attendees. My name is Benjamin Morden, and I'm the father to 3 adolescent daughters in 7th grade, 8th grade, and 12th grades. So this topic is clearly very relevant for my family. I'm honored to be on this panel to provide a parent and parent community education council perspective. As you heard earlier, I'm the Manhattan District 2 Community Education Council president, which overlaps with much of Senator Krueger's district. This is my 3rd year on the council, but prior to being the CEC D2 president, I've served as the Screening School Admissions Committee chair and the Remote Education chair. So as you can imagine, over the past 2-3 years, parents have shared with me their education and their social emotional concerns regarding their children. That said, I feel like forums like this are extremely important. We need to discuss the consequences of remote education. And before I share some of these issues, though, I want to bring up, it's been brought to my attention, a lot of these issues from parents. But I suspect many of you may not know what is a community education council and how that can be helpful. So I want to first briefly explain what is the Community Education Council, because our council, and specifically our council members, can be your parent resource to schools, to the district, and to the wider, to DOE Central. I'm going to share my spreadsheet, my PowerPoint, just one second. Okay. All right, so supporting your child's emotional wellness. The Community Education Council members are parent representatives and student advocates. The DOE states that New York City's community and citywide education councils, they are chartered, by the way, specifically in state code. They're charged with promoting student achievement, advising and commenting on educational policies, and providing input to the chancellor, to the education chancellor, or DOE chancellor, I should say, and to the panel for education policy, or PEP, as many of you might know. Each community education council has 11 voting members. 9 are parents, and community education councils are K through 8, pre-K through 8, and attending a district school or pre-K program specifically. These members are elected by parents of children attending these schools and programs. We just had our election in June. The results came out in June. We also have 2 residents or members, residents or members of the community appointed by the borough president. CECs must hold 1 public meeting per month, a calendar meeting with the community superintendent, while the parents and the communities may air their concerns. And you, as a parent, you would air your concerns not just to the education council, but also to the superintendent, sometimes the executive superintendent, and other DOE officials. There are 32 community education councils spread around New York City. The CEC's liaison with specifically pre-K through 8 schools, the borough executive superintendent, and the DOE's district superintendent, and the borough superintendent, as I said. CECs are specifically responsible for zoning changes, but we also deal with education policy, and I'll get into that because that's where we can do some good together with parents. There are also 4 other citywide councils. There's city councils for high schools, for English language learners, special education, and for special needs students. So what have I heard from parents? The one common theme that I've heard is that pre-COVID, my child thrived in school, but now, well, up until beginning of this year, they rejected remote education. So what was the verdict from all that? And many of you all know that too many students muted their mics, they shut their screens to remote education. So with remote education, we had an interruption of social emotional development. Speaking with psychotherapists, we've learned that this was a loss of school exposure therapy. And by going to school, in other words, your fears get diminished. And time again, we heard from little things that, impacting students. And now going back to in person, students are now having issues with simple things, starting conversations, just saying hello, because they were in a remote setting for so long that this has been a dramatic turn for many students. Last year, with the rites of passages, which are distressors, like graduation ceremonies, were less impactful because now they're e-graduation ceremonies. Graduating students were also anxious because they felt underprepared to enter either middle school, high school, or college. One therapist that I spoke with said 60% of her practice was made up of ninth graders, students who were entering high school. They just felt underprepared, and that created a tremendous amount of anxiety. Remote education also contributed to student isolation, as we all know and heard earlier, and soaring child obesity. So it also had physical impact. Another issue that we didn't realize till recently, that remote students lost autonomy. These older students, teenagers, all of a sudden they were packed in with their families, and they faced issues of extreme tiger parenting and monitoring, and just when they're going through their teenage years where they're looking for independence. So this added to their anxiety. And one final common theme that we also heard was that student executive function skills suffered, being organized, and just knowing when to do your work and showing up on time. Things like these things impacted students' anxieties and their emotional development. And because, for instance, they became over-reliant on Google Classroom. So now understanding what, let me just go back 1 second. What can the Community Education Council do? Well, one method in our toolbox is to write resolutions. We've written, since our new term began in July, we've written about 11 resolutions. Some of them have been Resolution 170, supporting recent District 2 middle school graduates who did not receive high school placements from their 2021 ranked choices. Many students were impacted by the change in the admissions process in New York City. And when many students in District 2 did not receive admissions to the schools and one of their 12 choices, that created tremendous anxiety. We had meetings where hundreds and hundreds of parents voiced their concerns, their displeasure, and they were seeking for solutions with the DOE. And we were working directly with the DOE to try to find placements to schools that fit our students' needs. And then we had Resolution 176, which may be a little more directly relevant to what we're discussing today, but Resolution 176 deals with providing supplemental learning and social emotional support for students, where we specifically ask schools to provide these needs. And you're welcome to read it on our cecd2.net website. And we also had Resolution 177 calling for DOE and NYSED to share data on how the pandemic has impacted student learning. Student learning loss is real. And we've, from state to state, we don't have the data yet in New York State, but from state to state, you're hearing in Ohio's learning loss of up to a year in math and up to a half year in reading. You're seeing that also, not to the same degree, but nationally, using the MAP tests, which was taken by 5 million people, 10 to 15% median changes in learning loss for math, and 10% of learning loss. This is learning loss in reading on what you would be expected to know for your grade level. So, and the students know that they haven't progressed at the rate that they had been previously. So this is a huge concern and leading to anxiety. So we were, in this resolution, we were asking for the DOE to share these needs so we can do interventions or accelerations in terms of the curriculum. So finally, how do I advocate for my student, school, and district? You can do it on the school level. It could be, if you're a middle school parent, you can still be a class parent again. You might have been a class parent in elementary school. You can be a class parent again in middle school. You can be a liaison with teachers, with PTAs and parents. How does this help? It creates social networks for parents and to participate and share resources and classroom knowledge, like school assignments. And again, that goes back to the problem that students had dealt with earlier that we've been hearing a lot from executive function. So in any way that you, just on that school level, being a class parent, you can help your child or students in the classroom. So that's on a classroom level. On a school level, you can can join the PTA or the SLT, the school leadership team. But how is this important? It's so important right now because during the remote education, many schools suffered from community spirit and pride. The students did not attend enrichment activities after school. They did not participate in school trips. Those were distressors. And so right now, schools need to return to that. And joining your PTA, joining your SLT is critical at this juncture to bring back that community spirit in schools. And finally, my own personal opinion, please attend our community education meetings monthly, our calendar meetings, to support our district, to provide parents. It's a forum to provide parents to learn about education policies, voice opinions, and influence change. All right, that's what I wanted to share, and welcome to take any questions from parents.
Thank you, Ben. That was excellent. And I think, it's a good, you were a good last speaker, because I think it's so important for parents to remember that schools with parental involvement are better schools. And there are lots of ways for parents to get involved in their children's education and to work to support the schools and support their children and other children, and that people don't know about all the work of the CEC. So thank you very much for representing so well. And now we're going to move to the Q&A portion of the event. We're going to start with questions that were sent ahead of time. And hopefully we'll have time to get through a couple of the questions that have been coming online as well. And you still can write your question out through either through the Zoom or the Facebook Live. But we're going to start with questions that we got in advance. And I think for a few, at least, we know who we're asking, but some are more open-ended. So cost and insurance coverage. Why is there no sort of plan to offer free in-person mental health services for all adolescents, not just those who may have Medicaid or in public school? Most therapists don't take health plans that people have, and if there were programs available whereby therapists were paid regardless of the insurance carrier, more parents could take advantage of these for their children who so need the care. So Erica, you were talking about so many of the programs through the school system. Do you think that it's actually true that pretty much if you have a child in our schools, you can find something out there? You just have to do some solid hunting for yourself, or,
So this insurance is always right. So insurance is always a tough issue, and there's a lot of differences between providers outside of the schools versus inside of the schools. And I could do a whole course on the mental health system. But yes, so if you are seeking treatment and there is a Article 31 clinic in the school, you should have access regardless of your insurance status. Most clinics, and again, this is different from private practices, but most Article 31 clinics are required to have a sliding scale fee. That's in schools or outside of schools. And they're not really allowed to turn people away, just like you can't turn someone away from the emergency room. They have to help you find equivalent services if they cannot take you themselves. So this is part of their mandate in terms of their license, just so you know. And in terms of insurance, as far as the schools go, yes, Senator Krueger, to your point, there are services in the schools. The schools really, if you can't find something in your school, you can reach out to either a parent advocate or a guidance counselor or a social worker or even the principal, and I'm sure that they will help you figure out what's best and what's available to your student.
So Erica, I'll continue with you. Is there a system for getting one-to-one sessions with therapists through any of the programs that you know of?
So traditionally, like I mentioned, so the Article 31 clinics provide the traditional, what everybody thinks about in terms of clinic work. And so that would be the way that you would get one-to-one therapy sessions through an Article 31 clinic. Again, there's communities that have Article 31 clinics, and they're not just a school-based service. But I know it can be hard. And what I will also say is this: there is a huge shortage of providers. And with mental health being on the forefront of everybody's mind, lots of providers are having difficulty filling the roles that they need filled for a multitude of reasons. And I know that there are wait lists, and I know that that can be frustrating. What I will say is, for parents who have access again to services in their schools, but also reach out to someone like Ben, and he will be able to guide you to the right folks to advocate. Like, this is a real opportunity to advocate for the services that your students need. I'm certainly right there with you. So I understand how difficult it can be. It's not an excuse. It's just, unfortunately, the system that we have, and we do have a shortage of providers as well.
And so part of a question was about if you have private health insurance, but providers aren't accepting the insurance. I just want to remind everyone, in this country and in the state, we are supposed to have what's called health insurance parity between physical health issues and mental health issues. So if you do have an insurance policy and you're finding it difficult to find anybody to go to or to take your child to, you should be reaching out to the central health insurance company saying you're supposed to provide a provider list online that's up to date, and it should be a robust one where I can try to find my child these services and see what kind of response you get from them. And if you're getting a bad response from your health insurance company, you could reach out to my office and we can attempt to intervene, because the state of New York actually is the regulator of health insurance companies in our state for our folks. So sometimes you have to fight and demand an appeal, yes, there is a shortage. Erica's absolutely right. But if you have health insurance that you thought was supposed to cover this and they're not, you should reach out to us as well. So, can students obtain in school?
I'm sorry.
Yes, please.
I just wanted to add two things. The New York City Department of Health website will soon have a link to a really excellent electronic resource in terms of finding clinics that are nearby. People just need to put in their zip code, and it will come out with a list of nearby mental health supports. That's called NOWPOW, NOWPOW, and that should be put on the website probably within a month. So that would be an excellent thing, for people in the community beyond schools. Yep.
Great.
I will also add just very quickly is that there's a lot of increased interest in telehealth and telepsychiatry and psychology and therapy. So those things they're not going anywhere. It just takes some time to get those things revved up. So, you know, there's definitely conversations around that.
Great.
And Senator, if
Yes,
I may
please.
add, thank you. As I stated earlier, New York City Well hotline number is a city-based resource that's free and confidential to all families. And at least I know that it has mental health professionals on the line that are live. So it's not like you're just connected to a computer-based response system. There are live therapists that are willing to help, at least until that family is able to find another mental health provider that it can be, as Erica shared, on a sliding scale to work with them.
Great. And actually going back to the telehealth, there was a question, can my child get a remote option if they have asthma or underlying medical conditions? I'm assuming we're talking about telemental health, but because of the child's health concerns, telemedicine would be a better answer for them. And I think that was something you just touched on, that there are some mental health services now available through telehealth as well.
And also some exploration into expanding that. It's a little dicey also with, you know, the emergency situation we were in. There were some regulations that were sort of eased in terms of licensure. Not to get too in the weeds about that, but yes, those are being explored as to being part of some programs that we're trying to iron out with the DOE.
Okay. So what can be done to advocate for more mental health services for children under 13? Apparently there was a tragic suicide of a 12-year-old member of our community earlier in the year whose parents had resources available to them, but who were repeatedly told that their 12-year-old didn't qualify for mental health services because he needed to be at least age 13. What is this age 13 start or stop point? I don't understand that.
I really don't know how that came into play. Most clinics, outpatient clinics, are licensed to serve 5 and above. Unless they have a specialization between 0 and 5, I don't know where this family went for services, but unless it was a specific model, I don't know who would say no.
It's Elliot. It's possible, and it is confusing. I agree with Erica that I can't imagine a clinic turning someone away due to a difference between age 12 or 13. It's possible the issue is an inpatient treatment, which many inpatient units for children stop, you know, at age 12, and then they'll start with, you know, hospitalizing adolescents 13 and up. So that may be what happened. You know, I'm just speculating. But again, I can't imagine, you know, how the family got that response.
Okay. And I don't have any more details that I can offer us right now. So thank you. Are there support groups for public school families at the local level outside of DOE online family academy videos? Do we know about that?
Again, to the wide range of services that are available in New York City, there is a panoply, so to speak, of all sorts of services that are out there. It really is a question. Again, it can be really overwhelming. It can be really daunting. You know, there's lots of private providers that provide services in groups. I would encourage, if there is a supportive service or a selective level service in your school, to really reach out and try to see what's available in the school, because it's easy access. You know, this is the environment that supports your student 8 hours a day and can be accessible. Again, I just really do want to stress that it can be really hard, and advocacy is a really big part of making sure your child gets what they need.
So If my child is starting to wake up in the middle of the night once school started, is that a sign that they're feeling stressed about going back to school?
I think that's a possibility. Kids could be waking up in the middle of the night because their sleep cycle was different during the pandemic. And now that they're back in school and on a different schedule, it may take some time to get used to it. Also, particularly teenagers, often, even before the pandemic, would stay up very late and go to sleep with their phones or watching TV or on the computer. On the other hand, often sleep disturbance is a sign of stress or anxiety, so that should be checked into further.
Right.
And also keeping in mind that our younger children may not know how to express or identify what they're feeling. So it may be expressed in different changes in behavior. One, difficulty with sleep patterns. So.
I'd just also like to add that blue light is a serious issue, and our parents have been advocating to try to reduce the amount of computer time, because the computers are being brought into the middle school and high school use more than they have been in the past now. And and then the kids are coming home and they're spending even more time on the computer. They're going right back to Google Classroom because now teachers, the curriculum, they're using that more often. It has its benefits, but the blue light issue of just can be impacting their sleep cycle.
I just want to emphasize, just like as our colleagues were saying here, like it could mean so many different things. Context is really important, and your child best. And really talking to an expert if you feel like it's impacting frequency, intensity, and duration. And basically what that means is if you feel like it's impacting your child's functioning, academics, then it is something that you should talk to whoever even your primary caregiver, or reach out to a professional who can do more in-depth of a assessment.
So one person's asking, why don't we have mental health curriculum for 5th to 12th graders so that they can be taught about what mental health issues are and what can be done about it if they're facing those concerns? There's a recommendation that we could use master and PhD candidate level students who'd get credit for coming in and teaching the classes, and DOHMH could collaborate with the graduate schools in the city. So I'm just curious whether, regardless of who would be able to teach them, has there been any discussion about trying to build in some kind of curriculum at the school? So have health curriculum. I'm wondering about a mental health curriculum.
Well, so keep in mind there is sort of a unit. So, and it's basically health and wellness within the DOE, specifically geared towards health and wellness. So again, just as diverse as, it's a very school by school based service. It's based on the principal, but there is a requirement by health educators to talk about mental health and mental health concerns. I think another thing you would be pleased to know is that over the course of the last 18 months, the DOE released something called Bridge Back to School, where they prepared their schools and their staff and provided them with trainings that they had access in trauma, and trauma specifically related to schools and classrooms, and what to look for. There is also, and again, this is specific to each school. I don't know the curriculum that they'll be using, but there is SEL rollout. So social emotional learning curriculums are being rolled out into the schools. Again, it's up to the principal to decide what's most appropriate for their school and for the population that they work with on a regular basis. But that is a curriculum. They all have to be CASEL identified or stamped of approval, which all basically SEL services, what they do is they stress the idea of sort of skills that kids need to be successful. And what's really exciting about those models is that you don't have to be a clinician to do it. And what that means is that you can be really hopeful and that anybody can do it. And I know people talk about trauma and they talk about resilience, and I hope that it's not a scary thing for folks to think about how just one positive adult in a child's life can really make a difference.
Right. So Dr. Madad, I'm sorry, yes, Elliot?
Yeah, real quick. Our group at DOHMH, is Community Mental Health, is actually developing a curricula for youth mental health. So a number of foundational trainings. In fact, the material that Susannah and I presented today is part of a much longer series. And eventually we'll be offering it to the communities, and we can send you information, Senator Krueger, about that to disseminate to your district. But we are starting youth mental health, increased access, knowledge, et cetera, with community organizations in what's called the TREE communities, which are 33 New York City communities that were particularly hard hit by COVID. And that initiative is actually starting in another few weeks. And I can send you that information on that as well.
Great. We're very big on sharing information and putting it up online and making it available. Thank you.
Sure.
So Dr. Madad, you were talking before about actually your family's own tragic experience with COVID. But so now we are into the Delta version of COVID, as you pointed out, and it seems to have, a lesser impact. Well, it's more transmissible, but it seems to have, less dangerous impacts. So if you have children who test positive for COVID, or you do yourself in your household, what are the rules about quarantine now that we're into a different model of COVID?
Right. So with the Delta variant, certainly much more transmissible, and as we talk about children and adolescent population, luckily they're not suffering from extreme severe disease compared to Alpha variant, but certainly seeing higher numbers of infections and hospitalization. So within that context, as we talk about isolation and quarantine, two really different terms, right? So isolation means that you've been infected with the virus, and it doesn't matter whether you're showing symptoms or you're not showing symptoms. If you're infected, you want to go ahead and isolate in your home for 10 days. So whether you're an adult or you're a child, you want to go ahead and isolate for 10 days. And when we talk about isolation, have a dedicated room, like a sick room, have a bathroom that's not shared. And luckily, New York City offers some really great wraparound services. So check out New York City Test and Trace Corp. So if you need any services, hotels, meals, they can provide that. Quarantine is a term that we use if you've been exposed to somebody or close contact that has had COVID-19. Now, in the settings of schools, with New York City public schools, so if in a classroom, if a child, for example, tests positive for COVID-19, the classroom doesn't necessarily have to quarantine if, for example, children are wearing masks consistently and they're at 3 feet of distance. It's because you have these additional mitigation measures, then the likelihood of spreading it to others is minimal. And so to also minimize disruption to classroom, you don't have to quarantine, but if you do have to quarantine, then your school would let you know. Now, outside the school setting, if your child, for example, has been exposed to COVID-19, I think it's always best to err on the side of caution and get tested, right? So I would definitely go ahead and get my child tested. So if they've been exposed, I would potentially wait, 2 to 5 days to get them tested, and then going ahead and quarantining them within that time frame. And then certainly, if they become symptomatic, I want to make sure I'm continuously monitoring them. The other thing I'll just very quickly mention is both within isolation and quarantine, if you see your child exhibiting any concerning signs and symptoms like shortness of breath, confusion, changes in skin tone, chest pain, anything unusual, it's always good to call your healthcare provider and get additional guidance and support. So always go on the side of caution, as a parent or caregiver when it comes to your child, and seek healthcare advice earlier if you would like to get more guidance.
Thank you. That's very valuable. Okay, so we're really out of time, but there's one more sort of question that I think Ben might know the answer to. Are there still free computers available for students in the New York City schools if they don't have one now?
Yes, there are. I don't know the exact number, but there are a number of iPads and tablet computers, and for the older kids, there are some computers left. If someone needs that, if they can I'll put my email in the chat, and I can connect them to the district. Well, it's that you might want to contact your FACE community district team, and that's who I would contact, the person, because there are some computers left.
Great, thank you for that. So we do have more questions, but we don't have more time. So I am going to thank our wonderful presenters, Elliot Goldman, Susannah Sanchez-Agosto, Erica Smith, Dr. Sara Madod, and Ben Morden for being here with us tonight. I want to share some upcoming events. Next Thursday, October 7th, from 7 to 8:30 p.m., I will host a town hall meeting on the 5 initiatives you're going to find on the back of your ballots when you go to vote in November for our citywide and local elected officials. Many people don't even know that these ballot initiatives exist, so we want to make sure you know about them. There are 5 of them. One's about redistricting, one's about same-day voter registration, one's about no excuse absentee voting, and then a constitutional amendment to the right to clean air and clean water. Then we're having our annual senior resource fair, which we're doing virtually again this year, because really putting 800 people in the basement of one building is not a great idea at this point in history. So we'll be sharing resources to nourish the body, soul, and mind virtually, and it's broken up over 3 days. So on Tuesday, October 19th, we will host an exercise, nutrition, and meditation event. On Wednesday, October 20th, we will share resources for your pets. Oh, that's a good one. That's new. And on Thursday, October 21st, we will hold our final session on arts, continuing education, and technology. All of those sessions will be from 2 to 3:30 in the afternoon. I want to thank everybody for attending tonight, our guests and our watchers. I want to remind everyone, continue to wash your hands, avoid large indoor and outdoor gatherings, wear a mask in public indoor settings, even if you are vaccinated. If you're actually watching and you haven't gotten vaccinated by now, come on, people, get yourself vaccinated. And it's important to get tested for COVID-19 if you develop symptoms or are exposed to someone with the virus, even if you are vaccinated. We're going to get past this, but we all have to do our jobs to make sure we get past this. So again, thank you, everyone. See you at the next round. Bye.